The U.S. provides a complex set of programs to assist low-income individuals and families, often referred to as the social safety net. In this module, we'll learn what the safety net looks like in more detail. We'll define what we do and do not mean by the safety net, talk briefly about how the safety net can or should be evaluated, and then go into some detail about the major components of the safety net. These details will include what transfers or services are delivered by different programs, how much we spend on the programs, and who or how many people benefit from them. First, let's be more specific about which programs we will cover here. The U.S. has a variety of programs that provide income or services directly to citizens. Here, we'll focus on a set of these programs that are called means-tested. This means that individuals typically have to demonstrate a fairly low level of income to receive these programs. I'll also stick to federal programs, those in which the federal government either finances all or part of program spending or sets at least some of the broad eligibility rules and requirements. This will include, as we will see, a variety of types of programs, from those providing simple cash transfers to those paying for food or medical care. This definition of safety net for our purposes will leave out some large and important U.S. programs that provide cash and other payments to individuals, but are not means-tested. Many of these programs are considered to be social insurance programs, but are not means-tested programs, so participating in them does not require a recipient to be low income. Social insurance programs also typically require individuals to contribute to the program at some point in their lives. Private insurance requires the payment of premiums on a regular basis in order to be insured against certain events. Social insurance has this feature also. For example, Social Security provides cash payments to the elderly, but only after they have paid into the system throughout their working lives. Similarly, unemployment insurance and disability insurance are financed through employer contributions. While we will not focus explicitly on these types of non-means-tested social insurance programs, such programs can play important roles in raising the incomes of otherwise poor individuals. Social Security is the most notable example of this, and is responsible for the dramatic reductions in poverty rates among U.S. elderly over the course of the 20th century. While this module will mainly be devoted to providing an overview and laying out details of the major safety net programs, it's also helpful to think about how we might want to evaluate or judge these programs as a matter of policy. The goal of safety net programs is to assist the poor, but these programs can be and are evaluated on several more specific criteria. First, of course, is program effectiveness. Do programs help individuals and their families better meet basic needs? We've already considered this to some extent when we looked at how the safety net was related to trends in poverty rates. This pointed out that the definition of poverty used can affect which programs are viewed as effective, and it is important to include safety net income of all types in our poverty measure if we want to measure effectiveness in that way. A related concept is that of cost effectiveness. This means that we also want programs to help as many poor as possible at minimum possible cost. Programs with excessive administrative or other cost would be less desirable. In some cases, cost effectiveness may involve the cost of other related programs. For example, some nutrition programs for infants have been shown to reduce medical costs later in life. This would suggest that the cost effectiveness of one program may come from reducing cost in another program. Economists often think about economic efficiency. Economic efficiency in this context requires that programs do not distort individual choices and behavior in undesirable ways. For example, many transfer programs may have the potential to discourage work. Programs targeted to single-parent families could distort incentives for marriage. Whether a program avoids these negative unintended consequences is often an important way in which safety net programs are evaluated by policymakers. There may be other considerations as well. We could evaluate safety net programs not simply on their ability to reduce poverty today, but also on whether they help individuals escape poverty in a long-term or permanent sense. We might also want to know whether programs target particular groups, perhaps the poorest of the poor or those we view as more deserving of aid. Often, these multiple ways of evaluating the safety net interact with one another, and so it can be complex to choose which work best or are most desirable from a policy perspective. This is a list of the major federal safety net programs. These programs provide a wide variety of forms of assistance. Medicaid provides medical insurance coverage to low-income adults and children, and covers some long-term care expenses for the impoverished elderly. Several programs provide cash transfers. Temporary assistance to needy families provides cash assistance primarily to single-parent families with children, along with job training and other work-related services. In 1996, TANF replaced a similar program, Aid to Families with Dependent Children, following major reform legislation. The Earned Income Tax Credit, or EITC, provides a refundable tax credit to low-income working families. Supplemental Security Income, or SSI, serves the poor with cash transfers who are also disabled or elderly. The next three programs, SNAP, School Nutrition Programs, and WIC, provide vouchers that can be used to purchase food or allow access to low-cost or free meals. Housing support for the poor is also provided in several ways. Housing Choice Vouchers, also known as Section 8 vouchers, provide a subsidy that can go toward rent to participating landlords. Project-based rental assistance and public housing provide directly subsidized rental units to the poor. In public housing, tenants are generally expected to pay roughly 30% of their income toward rent and must have income that is below roughly 50% of the area's median income level. Finally, the Head Start program provides public preschool to poor children and provides parenting education and other support for their parents. All of these programs make up a complex safety net and are joined by a variety of state and local programs, as well as assistance provided by charities and nonprofit organizations. To get a better sense of the relative contribution of each of these to the overall safety net, this figure shows the level of expenditures based on the year 2014 or 15 for each program. Immediately we see that spending on Medicaid swamps spending on all of the other programs. This primarily reflects the fact that medical care, especially for the subset of those with severe or chronic illnesses, can be extremely expensive. In fact, in addition to those qualifying for Medicaid on the basis of having low income, some individuals qualify for Medicaid by virtue of having particular medical needs, known as being medically needy. Thus, Medicaid, unlike most of the other programs, provides very high levels of spending to some individuals, those with greater medical needs, and lower levels of expenditures to its relatively healthy recipients. Another way to think of the relative size or importance of programs is by looking at the number of individuals they serve in a given year. This is shown by the red bars on this figure. While Medicaid does serve a larger number of individuals than other programs, its costs remain far higher than a proportional increase for its higher caseload would suggest. Its costs remain far higher than a proportional increase for its higher caseload would suggest. To better compare the other programs, this figure drops Medicaid to focus on the scale of these other programs. The largest programs in terms of caseload after Medicaid are the nutrition programs, SNAP, and school lunch programs, followed by the Earned Income Tax Credit. To make sense of widely varying caseloads for these different programs, it's helpful to think about two different types of eligibility requirements for the different programs. Because we're looking at means-tested programs, all of these programs have rules for what is called income eligibility, or a rule for how low income, adjusted for family size, must be for the family or individual to be eligible. Programs with lower income eligibility thresholds will typically serve fewer individuals. In addition, many programs also have what is called categorical eligibility requirements, restrictions on the categories of individuals or their characteristics to be eligible for this form of assistance. For example, those who are elderly or disabled are categorically eligible for the SSI program. If we compare TANF and SNAP, these categorical eligibility differences are important. TANF is available primarily to children in single-parent families and their parents in most cases. In contrast, SNAP has no similar categorical eligibility requirement, and so it serves a much larger population. Similarly, the WIC program is available only to pregnant women and those with children under the age of 6, so again, it is a relatively small program in terms of its total caseload. Differences in income eligibility rules also tell us something about the size of the caseload. While all of these programs are aimed at serving low-income individuals, they have a variety of cutoffs for the exact amount of income to qualify. TANF, for example, has income eligibility levels that vary by state, but most states make TANF benefits available only to those with family incomes well below the poverty line, often less than half the federal poverty threshold. Medicaid, in contrast, serves individuals up to 138% of the federal poverty line in many states. SNAP and school lunch programs serve families up to 130 and 185% of the poverty line, respectively. Given the complexity of the set of programs, the types of assistance offered, and eligibility, it's difficult to summarize or characterize the safety net as a single system, since it is clearly made up of many separate but interrelated parts. In Module 5, we saw that our cash assistance programs have declined in terms of benefits offered and caseload over time, but other types of non-cash benefits have increased. This figure shows the long-term expansion of the safety net in its entirety. From the 1970s through the early 2000s, total expenditures on federal and state means-tested transfers, adjusted for both inflation and population size, have grown significantly. Another measure of the complexity of the safety net is the extent to which individuals receive support from a variety of programs simultaneously. This figure shows the percentage of families receiving TANF who are also participating in other parts of the safety net. Notably, TANF families are automatically eligible for health assistance through Medicaid and state medical insurance for children. TANF participants are also almost always eligible for a variety of nutrition assistance programs. Finally, we finish our overview with a glimpse of the extent to which these safety net programs directly reduce poverty. This table provides an estimate of how different poverty rates, as measured by the SPM, would be different if individual programs did not exist. The actual poverty rate in 2014 was 15.3%. The table shows what that rate would be if income or benefits from individual programs were eliminated from the resources individuals received. TANF, for example, barely changes the poverty rate. This reflects the fact that TANF serves a relatively small fraction of the poor, and the fact that benefit levels are low, and so recipient families may not be lifted above the poverty line. Other programs, in contrast, can play a much larger role. Social Security, which we have not discussed because it is not a means-tested program, nevertheless reduced poverty in 2014 by 8 percentage points. Nutrition programs and tax credits reduced poverty by smaller, but also important and measurable amounts. In the next two modules, we'll focus in more detail on two parts of the safety net, TANF and the Earned Income Tax Credit.